I'll be hosting or bringing together 30 non-medical prescribers or pharmacist prescribers from across the country to undertake a workshop where we're hoping to maybe tease out some ideas about how pharmacist prescribers should be practicing within the NHS and understand some of the differences that people have when it comes to prescribing and their thoughts around prescribing, in order to try and standardise some of that and take some of the good learning and spread it across the workforce. One of the things we want to ask is we want to talk about success stories, so what's worked for individuals in terms of setting up services and actually delivering care. So if someone is working alongside a nurse as opposed to on their own, how did that work? And is that something that we should be recommending everybody does? We know that pharmacists and nurses have different and complementary skill sets, and does that provide the patient with a higher quality care than a pharmacist working alone? We've also got a number of different models which range from pharmacists prescribing without any patient contact to pharmacists performing physical examinations on patients and making decisions around dose reductions and tailoring of treatment to individuals. So it's understanding what the pros and cons are for that and giving people some structure or guidance around what they should be aspiring to do themselves. The workshop tomorrow is probably what I would consider one of the first steps. It's getting those people in a room, giving them access to each other so that they can share information. I think we need to be the people that set the tone and actually, develop the structure and the framework within which pharmacists should prescribe. I don't think we should wait for that to be imposed on us. I think we're the people with experience and we're the ones at the front line, and I think that really enables us to shape the profession as we move forward into these new and expanded roles. I think patients will get more consistent care, better access to care, and hopefully a better quality of care. So ultimately it will be patients, and I think the healthcare professionals will also benefit. They'll get a better, greater satisfaction at work. We'll hopefully spread the workload a bit better across the workforce, which means people will have a bit more time to do the things which they should be doing, and I think that should benefit everybody. I think we're making rapid progress at the moment, and I think the forces that are pushing this forward aren't necessarily going to go away anytime soon. So I think it's about making sure that those steps that we take forward are well thought out, well informed, and that will probably dictate the pace of change. But we've certainly got the freedom to perform these functions. It's just making sure that we do it in a safe way so that patient care is maximised and not compromised.